Health reform. So why do I think this fits to all this? In my view, regardless of my role with McCain and everything else, and subsequent to that, I view health reform as basically putting more dollars in the system. I don't believe, and anyone can Google my name, they can see stuff I've written on this in op-eds. I do not believe this is cost-saving in health reform. It just can't be. I think the CBO estimates they're double counting the savings for expansion. Alan alluded to that, but you can't have it both ways. It's either going to save Medicare or it's going to expand coverage. If you take that $500 billion away, it's expensive. With more dollars in the system, I think that's actually a good thing. I agree with Mark Pauly on this. But to the point down below, it's a giant macroeconomic gamble. So, when have we otherwise had giant macroeconomic gambles where everything turned out right? Well, usually they're not the best things to look at, but it's sort of equivalent. World Wars. World War II. Huge capital influx. Probably the closest moment since the Depression where we basically blow our GDP into debt. Okay? What do we get out of it? Jet planes, granted stolen from Germany, but so be it. We get the nuclear bomb. We get the Modern Industrial Research Laboratory. We get NIH on steroids. We get medical innovation. We get penicillin to wide distribution. There's so many things that come when there's a giant infusion of capital. Is this going to be the same thing? No, but it's going to bolster things up. What population is actually going to do this? Because you're thinking, wait, Medicaid expansion, how's that going to work? The population that's going to get the money that never got money before is the subsidies for that lower middle class. Mark Pauly alluded to it, right? But these are the folks that are basically the uninsurables that will now have big subsidies. 45 to 65 years old, they drink, they eat, they smoke, and they're going to have coverage. And they're going to need defibrillators. And they're going to need diabetes treatment. And they're going to need innovation. And the dear hope is that one of these things, the yay part, is there will be an innovation that comes out that, let's say, cures diabetes. From a societal standpoint, that's fabulous. From cost, macroeconomic, fabulous. If you're a hospital, you're really pissed off because you just lost 20% of your revenue, so we have to sort of moderate that. The issue is you live longer with little functional improvement other than high dollars. That's where this goes wrong. We just put a lot more money into the system, what do we get? So, true-false question for discussion. Is all this going to bend the cost curve down? We hope so, but depends on how pessimistic you want to be with this thing. And if nothing else, your friendly neighborhood university is your high-risk reward partner for this proposition. And with that, in the interest of time, I welcome questions or discussion of any nature. Thank you.
It's Brett Johnson from One Med Place. I'm curious, what's been the experience of other universities in the technology transfer business? Because that is a big area. Who else is doing this, and what's been the experience?
Well, first, it's a limited set of schools that actually have sort of healthcare MBAs that focus on the medical technology space. So when I talk to folks that say, the folks I know, there's Wharton, Harvard, MIT, Northwestern, they typically work, it's not as many schools involved. The law school is not involved. That makes it a bigger issue. What you usually find is something that's joint between medicine and engineering and the business school. So Stanford has a model that's similar to that idea, but doesn't quite go as far as you want to go. And it also doesn't engage the Office of Technology commercialization at the universities, which, to be honest, when we started this thing out, we kind of went from, their reaction to us was, we're curious, we want you to die, you just saved our butt, to we now have a happy equilibrium model.
Do you get funding for these deals from the private sector?
Yes. Yeah, we've now more or less signaled a recurring flow. I mean, we basically charge $15,000 per project. Sometimes the inventors don't have it, so we have resources in the institute to pay for that, but long term we're looking for long membership fees, and actually they seem to be arriving now at a suitable rate to keep us going. But we're always looking for new projects.